Hi, this is Dr. Nick. I'm the Incrementalist here this week talking about improvements for better health and for better business. Good news, it's a glorious day. It's the 4th of May, or May the 4th be with you. And this week I'm talking about a couple of the clinical signs and symptoms that we're seeing as part of the disease that I think are interesting. So most people are familiar with the sort of flu-like or influenza-like symptoms, fever, cough, typically a dry cough in the case of COVID-19. A couple of other things that have emerged, and I think most people are aware of the anosmia or loss of smell. Certainly something that we're seeing, and I think that's a good indicator from a clinical standpoint to let us know that somebody might have the disease or is quite likely to have the disease. The other thing that we're seeing is something called Petechiae. Those are the little small blood clots, essentially, or that you see in people's fingers. We're seeing it in the feet of folks and across the body. And it seems to be that the virus is causing coagulation problems in people's bodies. We're not sure exactly of the mechanism, obviously something that's going to emerge, but it gives us another sign that we can look for in the case of diagnosis to find patients that have it. And it also gives us a laboratory test that has been proven to be helpful in terms of finding those patients or confirming those patients, called D-dimer. It looks for the downstream products of those coagulations or clotting, and if you see an elevation of that, that's an indication of those coagulation problems in conjunction with these other symptoms and signs is a good pointer to somebody actually having the disease. I've talked elsewhere about the gender differences. I think, again, those are interesting and certainly will lead us down a path to more discovery and potentially more opportunities for treatment. But let's focus on businesses and some of the things that I think we're going to see changing and the things that you're going to need to change in your business. And number one in this case, from my perspective, certainly for today, is waiting rooms. The idea that we had waiting rooms, and I know Dell Medical School was one of certainly the early innovators in this space where they built a hospital with no waiting rooms. Just the principle, or even the name, seems a little bit extraordinary, but imagine that in the new circumstance where you've got to really think about physical spacing for people that are sitting in that waiting room. Now suddenly you've got a much less efficient use of space. It's not something that anybody ever likes. I don't think there's any patient or any person anywhere that likes sitting in a waiting room. And it has lots of opportunity for spread of disease. If you think about the magazines that were there, I'm willing to bet that we're going to see a decrease in subscriptions to magazines that were essentially being propped up by a lot of these places that would have those magazines. They're, of course, a source of contamination. When somebody picks it up and then puts it down, are you wiping those things down? So I think you'll see those removed. But probably even more likely, and if you really want to innovate and transform, you should be thinking about just completely replacing the concept of a waiting room and having no waiting room, or having something that is almost like the just-in-time manufacturing process where we bring people in at exactly the right time, we give them other things to do, we schedule. And I know certainly, I think the Mayo Clinic has this down to a fine art where they have an automated scheduling system that sends patients to different places, and if they're not able to come for an appointment or part of their screening process in one of those departments because somebody is taking a little bit longer, then they automatically adjust and communicate that. I think we're going to see more of that in the case of businesses, certainly in the case of just regular businesses, non-healthcare related. The other thing that I'm sure you're going to have to think about is virtual programs. So I'm already seeing this. So I have an exercise class that I have the fortune of participating in my local health club, which of course is closed for the time being. But we've moved that onto Zoom, and it's not a perfect option. You know, sometimes these things fail and we get dropouts and so forth, but it's better than nothing. I think we're going to see more of that virtual program and delivery of solutions that way, and people are going to become more accepting of that because it makes sense. We're adjusting to it. I think Zoom is becoming a verb as much as anything. We Zoom things, we Zoom our birthday, we Zoom drinks in the evening. So all of that is adding up to a shift away from this sort of centralized delivery. And that leads me to my final point, home monitoring. So home monitoring and this virtual delivery of care is dependent on actually capturing data. So we've been reasonably good at capturing data in the home setting, and I certainly have had, and I talked about in one of my previous videos, the automated weight system that Fitbit has and others do that essentially communicates to the cloud. So all I have to remember to do is to step on that weighing scales, which I do now every morning, and I have an immediate tracking and the ability to follow. But that also means that I can share that information. It gives me some input. I think we're going to see more of that in the way of devices. So wearables become even more important in the context of this post COVID-19 era. We're going to see more home monitoring, and you can even imagine, I know people made fun of these internet connected devices. Why would we want all of that? And certainly one of the things that Michael Dell talked about was the incredible expansion of this and the importance of defending that from a security standpoint, so making sure that that increased edge, especially in the home setting, is covered. But whilst we made fun of it and couldn't understand it, partly that was because we couldn't imagine some of the use cases. And in this case, the idea of an internet connected thermometer, in the same way that my weighing scales has an internet connection puts up into the cloud, is actually a very plausible scenario that gives us some opportunity for monitoring of temperature. And by the way, temperature or body temperature is not a normal. So people tend to talk about this 98.4 as the normal. That's a mean that was taken from the 1800s. And thanks to Maggie Carey, who sent me the article that sort of detailed all of that, certainly aware of this failure of averaging out the human population. And what we'll start to do, in the same way that I do with my weight, is understand what the individual's normal is and use that as the benchmark for determining if they have a temperature from a disease or if there's maybe some other reason that they have a higher temperature. It's just going to become another monitoring tool. And I think we'll see that with other monitoring tools. I've certainly covered the blood pressure continuous monitoring. I think that's absolutely going to be an imperative as we start to push things out into the home setting where people are going to spend more of their time. And quite frankly, that's good news in many instances, not to diminish the importance of social contact. So few thoughts and ideas about how businesses are going to change, what you're going to have to do to change or move your business to adapt to these new settings. Until next week, I'm Dr. Nick, I'm the Incrementalist, here for healthier business and healthier life.